Hi, good afternoon, everyone. I'm the last presenter, so I need to make sure that everyone's still awake. So we'll do some audience participation. Can you please raise your hand if you've ever filed an insurance claim? Auto insurance, medical insurance, travel insurance. Okay, about half the room. So keep your hands raised if you thought that that was a great experience and you would recommend it to a friend. Okay, there's no crazy people here. Last question. How many people here have used a tool like ChatGPT, Claude, Mistral, a tool like that? Probably around, okay, about half the room is open. So imagine if, thinking back to your claims process, you could have just told ChatGPT, okay, please file this claim. That's essentially what we do. We work with hospital providers, clinics to help them automate their claims process using AI. So I'm Gabby. I'm the co-founder and COO of Swiftclaims. I used to be with Cash App, a fintech company based in San Francisco, where I led our BizOps team. We had about 80 million actives by the end of the time I was there, and we did 15 million USD in revenue per year. My co-founder, Lewis, he's a doctor and previously was a GM of a medical device company. And he worked with a lot of providers here in the Philippines trying to figure out why they kept telling him that their claims for their devices were getting denied. And he decided to start Swiftclaims. So I had the honor of representing a small but mighty team today. So what does the market look like? Every year, Filipinos spend about 24 billion US dollars on healthcare. About 44% of that is out-of-pocket spend. The remaining of that is things like PhilHealth, private medical insurance, other government schemes. And so we plan to tackle that 56%. So that 44%, why is that still happening if people have insurance, PhilHealth, for example, is our national provider. Technically all Filipinos are covered. Why do we still have out-of-pocket expenses? One of the big reasons is because the claims process is complex. The standard claim takes 30 days quoted, but in reality it takes closer to 120 days. PhilHealth, just itself, has to process at least 36,000 claims a day. So imagine if you're filing your one claim, how long that took, and do that 36,000 times every single day. And the losses from delays, denied claims, having to pay your staff to go back and forth with insurance providers, that adds up to about $1 billion per year. So Swiftclaims, as opposed to the 120 days, right now we're taking about 7 days to process a claim. In the period that we've been active, we haven't had any delay that's been longer than 1 day. We enable providers to process 5 times the amount of claims. And with an error reduction rate of 99%, we think that we can bring that 60 billion pesos or $1 billion down to zero. So how do we do that? We do that through a variety of AI products that focus on each part of the process of filing a claim. And so generally, no matter who your insurance provider is, there's kind of 4 steps. Your provider needs to be first accredited with that provider. And so if the health insurance company, they're not accredited yet, we help them understand what you need to be accredited, and then we help them put together that paperwork to submit and get accredited. Once they are accredited, they can begin submitting claims. And so when you file claims, that's usually dozens of physical forms that people are filling out manually. So we have a couple products there that focus on helping providers understand, one, what am I eligible to claim for? And what are the requirements to claim for that? And not only that, but before they even submit the claim, we enable them to be able to check, are there any errors with this claim? And so you remove the back and forth between the medical insurers and the providers, and instead at the time of claim, they pretty much know that it will be accepted. Once it's accepted, they still need to pay. Oftentimes in the Philippines, it's through a check. And so instead of waiting for that check to arrive, which again can take up to 40 days, we're developing a product to help people get paid in advance, and we collect on their behalf for their payment. And in the 1% of cases where there is some sort of error, we help them refile. So similarly to how we want to make the medical system here in the Philippines more transparent and simple, we also want to make our pricing simple and transparent. And so our monetization scheme only kicks in when a provider gets their claim approved and monetized. So if we have 24 billion in spend per year, around 60% of that is claimable. That's around $13 billion a year. We think taking 5% on top of that presents us with a 650 million USD recurring revenue. So where are we now? June of this year, we signed a proof of value agreement with PhilHealth, which essentially is just saying we're both committed to solving this problem together. We have over 20 partners across hospitals, mental health and telehealth providers, other startups in the healthcare space providing services to consumers, insurance providers, again, both public and private. We've processed around 2,500 claims at a 99% accuracy, 100% in compliance with different insurance providers, different policies. From start to finish of submitting a claim, it takes us about 2 minutes, and we can process around 400 claims per hour. So if you're a provider that's interested in processing your claims quicker, or have a bunch of outstanding claims that you're trying to figure out why are they getting approved, if you're an insurer that has a big headache processing claims or paying claims, or if you're an investor that wants to join us on this journey of revolutionizing healthcare claims, you can reach out to Louis. His email's out there, or you can also reach us on this form, on this QR code. I'm looking forward to hearing from you.